Welcome back to HLN Now. I'm Yasmin V, and we're starting in search mode today with the biggest story on Google, Ebola. The second nurse who contracted Ebola from Liberian Thomas Duncan is cured. Amber Vinson spoke at Emory University Hospital a short time ago.
While the skill and dedication of the doctors, nurses, and others who have taken care of me have obviously led to my recovery, it has been God's love that has truly carried my family and me through this difficult time and has played such an important role in giving me hope and the strength to fight.
The other Ebola patient here in the United States, Dr. Craig Spencer, remains in serious but stable condition. His case and nurse Casey Hickox being quarantined sparked the conversation about if people coming back from West Africa should be quarantined. You've been debating that on our Facebook page. I want to bring in again Dr. Devi Nampia-Parampil, assistant professor at NYU School of Medicine, to answer some of your questions. Dr. Devi, thank you so much for joining us. Of course, I want you guys to call in at 1-877-TEL-HLN or tweet me at Yasmin V with your questions. All right, Dr. Devi, I want to go to our first caller, Barbara in Florida. Barbara, what's your question about Ebola?
My question would be why we can't commission a ship to bring these people back and quarantine them while on ship and care for them as ship patients rather than allowing them to fly into our airports and possibly infect the entire east coast of the United States.
All right, Barbara, thanks for calling in. You know, so Dr. Devi, you heard Barbara calling in. Obviously, this is still the fear that people have, is healthcare workers coming back here to the United States while infected with Ebola.
Well, there are a couple of things to consider. I mean, just because someone flies here from West Africa, it doesn't mean that they have Ebola for sure. So you don't want to just take people and take away their rights and, you know, decide how they're going to travel or whether they're going to travel. I mean, the other thing to consider, just directly to your question, I mean, with a ship, you know, it depends who owns that ship, which country and which territory are you in. And second, if you have people who are healthy, you don't want to put a whole bunch of people together with somebody who could potentially have Ebola or any other kinds of conditions like malaria or something else, and then potentially have it spread through the ship. So,
and I'm happy that you mentioned that, because that's actually what's happened before, right? If you put too many people in a room to quarantine, like what happened in West Africa, then they just spread the disease amongst themselves.
Exactly, and that's one of the problems that happened in West Africa. So people actually did voluntarily quarantine themselves. They went to these centers, but the problem is they didn't have enough space. So they put people in these really close quarters where they actually did have an exchange of bodily fluids, and people who were healthy became sick. So that actually made the spread worse.
Right. All right, let's take our next caller, Clay in Minnesota. Clay, what's your question about Ebola?
Yes, I have a curiosity about the source of this Ebola.
So we're not getting Clay, but I actually... Oh, okay.
What actually contacts... how does a person contact Ebola at the source? Where does it come from? Plant, animal, water, bad water, or... I'm curious as to that.
So the theory...
Yeah, Dr. Devi, so that's a really good question. You know, where does Ebola come from?
Well, Ebola has been around for a while, since 1976, and it's been different strains. So this particular strain that we're dealing with, the theory, I mean, no one knows absolutely for sure, but the theory is that it came from a bat, you know, maybe from bats, and then infected a child, a 2-year-old in West Africa, who then, you know, spread it to his immediate family members, and then one thing led to another as people who came to the funeral kind of traveled. So the key there is that this was very close contact, you know, that these family members had, and with the funeral, we think that some of it had to do with the burial rites and the bodily fluids, and that's how it actually took hold there.
Right, and ultimately they have different procedures for burying Ebola victims.
Exactly.
Now, right? Okay.
Exactly.
So let's take our next caller, Modeline, New Jersey. Modeline, what's your question about Ebola?
Well, I want to find out, when they do not quarantine the workers when they come back from Africa, and then they let them go home to be monitored, but they have family members living in the house. So let's say after a few days they get sick. Now, why would they have put the family members, the people around them, to let them get sick also? Right. I'm not sure which way is better, the quarantine or if it's safe to let them go home.
That's a great question, Modeline. And, you know, Dr. Devi, that is somewhat part of the new procedure and the guidelines that the CDC has put out, in that people are going to self-quarantine. They will quarantine at home. But what about the family members, right, that are close to these potential Ebola, you know, people that may test positive for Ebola or may test negative, of course, you know, but they're in their homes, they're surrounded by their family members, they're self-monitoring, and if they do come down with Ebola, then those family members are at risk.
Well, the home quarantine is a nice kind of middle-of-the-road compromise in the sense that, you know, when you talk about quarantine centers, you have a problem because you're talking about taking away people's rights. But at home, at least people can have some freedoms. Now, with the family members, you're right that they could have some close contact, but at least they would be aware that the person's under quarantine. And second, you actually know who your family members are. So the second that somebody starts having symptoms or something else happens, then the CDC or other health officials can kind of jump in and also keep track of the family members and continue the quarantine that way. Now, the thing is, of course, the family member doesn't have to come into close contact. I mean, they can choose to stay somewhere else, but you just want to give people some freedom so they can actually comply with the quarantine.
Right, and it's also important to note, again, that these are healthcare professionals that understand their symptoms. They've been treating people with Ebola. They were over in West Africa. They saw the disease from A to Z, right? And ultimately, you're not infectious until you are shedding that disease like nobody's business, when you have that 104 fever, when you're in the throes of Ebola, right?
Exactly, and like we were talking about yesterday, even Thomas Eric Duncan, the first person who came here with Ebola, you know, he stayed with his family and he actually was having symptoms. He went to the ER, he came back to his home, he was still having symptoms, but nobody in his family actually developed Ebola. So it goes to the idea that Ebola actually is very hard to catch, and that's why even though we are seeing more cases, we're seeing very isolated cases. You know, we can count them on both hands in terms of the number in the U.S.
Right, and in the last hour, we talked a lot about how many people were actually working over there, how many healthcare workers were actually working over there, and how many have actually become infected, and it's a very small number. So ultimately, it's not passed very easily. All right, Dr. Devi, you're going to stick around because we're going to be answering some more questions next. So keep it here on HLN. Plenty more coming up.